Now, a special report we've been investigating for weeks now. It's a diagnosis hundreds of families in East Tennessee have to cope with. It has lifelong impact. Yesterday, we explained just how common neonatal abstinence syndrome is here in East Tennessee.
It's when babies are born exposed to opioids. Brittany Tarwater and executive investigative producer Emily Akiyama shares some of the solutions to supporting families.
It's a special clinic serving a special population.
So there's just a huge need, and it's a beautiful job because there's some really great outcomes.
Talking with Caroline Milford, you can see she's passionate about her job and the kids and caregivers she helps at East Tennessee Children's Hospital's Grow With Me clinic.
We have a huge population in East Tennessee, so it's really important that we all work together to treat these people well, to help them with their services, and let them grow up the way they deserve to grow up.
That huge population is children who have been diagnosed with neonatal abstinence syndrome, or NAS.
All of them are exposed to the drugs while in utero.
In 2022, nearly 800 cases were reported to the Tennessee Department of Health. That's around 1% of all live births that year.
Our babies, when they are first born, a lot of their symptoms from the NAS diagnosis show up in difficulty regulating themselves, calming themselves. They often have a hard time eating because they can't quite get themselves together to do that very natural act of eating. Have difficulty sleeping.
These children cope with lifelong effects.
As they develop, what is kind of being affected is changing.
The Grow With Me clinic works with children from the time they're discharged from the NICU to age 5. Right now, more than 550 are enrolled in the program. Milford says the children they see have a range of long-term symptoms.
As they get older, we tend to see a lot of sensory processing needs. It's a very high need for our kiddos, which can present itself as a behavioral issue a lot of times, so hard for caregivers to kind of pinpoint what is the need there.
And it's not that these kids don't still need help after they turn 5.
We would like to keep our kids even longer than we do. There's a need for us to keep them longer than we do, but we are only so many people and there's so many kids that need us that there has to be a point where we are able to kind of let them go, so to say.
Dr. Lovey Stallworth at Servolution Health Clinic says she also tries to help her patients' parents with as much support as possible.
Maybe just listening and say, yes, I hear you, I see you. You're not the only one that's dealing, with a fussy baby. This is what I did.
While places like East Tennessee Children's Hospital and Servolution are part of the solutions, both agree there's still more families need. Milford says there aren't enough options for behavioral health care.
There are not a lot of physicians and practitioners that are specialized in that area, and behavioral therapy is huge for our kids.
Stallworth says in a rural area like Claiborne County, where Servolution is, it can be hard for families to access the support they need.
If mom is working, is there a daycare that's going to, manage these fussy babies, may have slow development, or just need that extra support?
But even with the barriers, Stallworth stresses there is help.
You don't have to do this by yourself.
All to give moms and babies their best chance.
That our kids do have the ability to be awesome. They're fabulous children. They need help, but with the right services, they do very well. Our mothers are good people who also need some help at times, and also do beautifully with the right tools, the right support, being treated the right way. There's so much room for success for these kids and these families.
The State Department of Health's annual NAS report also lists several recommendations.
A couple of them include screening for substance use during pregnancy, improving access to treatment and resources for women, and reducing the stigma associated with substance use and mental health conditions. We have the full list of recommendations now in the WVLT News app. Tap the Investigates section, and we do want to hear from you as well. We want your stories. You can connect with us about mom and infant health or any other story you want us to look into, all in that Investigates section.